Malaria is a major public health problem globally, though the 2015 World Health Organization malaria report has it that its prevalence dropped with about 37% globally and about 47% in Africa. Sequel to this, malaria-related mortality rates also reduced. In Nigeria, report has it that there is appreciable progress in the fight against the disease, resulting in about 18% reduction in under 5 mortality rate.
Malaria is been a serious issue in me. I've been treating malaria often and often. But whenever I take this tablet and treat it, maybe in a space of 2 weeks, it will come back again.
I've had malaria this year like 3 to 4 times.
I've had malaria like 2 times in this year. And whenever it happens, I consult doctor and they undergo test, then they prescribe drugs for me.
However, observers say the recent increase or recurrent malaria cases shows that a lot still needs to be done. Drug resistant, treatment failure, insecticide resistant, and climate change are identified as factors that might be responsible for the situation.
We know that the malaria parasite is a very trickish parasite. That is why up to this moment we've not been able to find out now a vaccine for malaria, because the parasite is able to change its form. This process that is able to repair these holes, this damage is caused by drugs. You will need optimum dosage. So the key thing here is the dosage. When we start taking these anti-malarials and we feel better, the tendency is for us not to continue. For others who take these drugs, do they even take it at the correct time?
Political will, adequate local research, robust surveillance system should be put in place, as well as regular enlightenment of populace on the ills and prevention of malaria.
We clean our environments. We try to remove the breeding sites for this mosquito. That will reduce it to some extent. Once bitten, we should go to the correct facility to have the diagnosis, get the right medication.
Experts also discourage self-medication and advocate environmental and personal hygiene. Rashidat Mustapha Olagunju, NTA News.